Hey Joes, I'm here with Melissa, one of our anesthesiologists at CG Cosmetic Surgery. Melissa, thank you so much for allowing us to interview you.
My pleasure.
How long have you been working here at CG?
Over a year.
Over a year. And how did you end up becoming an anesthesiologist?
Okay, well, I'm a certified registered nurse anesthetist, so I have been in the medical field for over 14 years, 2 years doing anesthesia. I love direct patient care. I love cosmetics, so it was just definitely the way to go. I feel like I'm very relatable because I'm a woman, so when I walk into the room, the patients feel more comfortable. I'm open to listen to what they have to say in regards for the procedure, even if it's not anesthesia related. So I think it's like right up my alley for me to be here.
That's lovely. You made me feel very comfortable, by the way, when I got surgery. Let me ask you a question. The other day I asked our patients what was the #1 fear they had when it came to getting a procedure done. And most people said, I'm afraid of getting anesthesia and going to sleep and never waking up. How realistic is that fear?
It's very unrealistic, even though that's something that media hones in on for anesthesia. Anesthesia has evolved so much over the last 20 years. It's super safe. We have the state-of-the-art equipment here to make sure that we keep the patient safe. We're monitoring their blood pressure, heart rate, oxygenation. Everything is being viewed in real time. So we're always vigilant, and we always make sure that we're the eyes and ears of the patient when they're asleep. I know a lot of people, they would rather go and be awake, but you're very uncomfortable. It's very stressful because you hear everything that's going on, which is considered a local anesthesia. You hear the equipment, you hear people talking. When you think about surgery, you just want to let go and let it happen. This is a general anesthesia. They're intubated for the majority of their procedures. I will protect their airway and make sure that they're safe. So I'm breathing for them. Once they're done, I'll get them back breathing. I wake them up and they transition smoothly to the recovery area. For me, that's the way to go. I do anesthesia. I know how it is. People are very afraid. You're safe. It's like Allstate. You're in good hands. Don't worry. So they will regret like ever being fearful. That's the last thing they have to worry about.
Right. What are the different types of anesthesia, and do we do them here, or is it just general anesthesia that we do
So
here?
we do a combination. A lot of places they'll just do like a local, especially for their lipo. So they inject local anesthetics so they're numb. The problem with that, some areas may be numb, some areas may not be numb because you're not 100% sure.
Right.
So they won't be able to tell until the patient's actually undergoing the procedure and awake. Oh my gosh, I feel it, I'm in pain.
Right.
This one we do a combination. They do local to help post-operatively, but for the majority of the procedure, general. So they're asleep. So they never have to feel fearful or say, oh my gosh, I'm in pain, or feel any discomfort. So that's the difference. But then the local anesthesia carries over for after the procedure to help with post-operative pain.
Well,
So we do a
great.
combination.
How long do you sleep for doing a procedure?
Depending on the procedure, breast augments are minimally invasive for the most part, so it's about 30 minutes. When you talk about BBL, Brazilian butt lift, depending on the size of the patient, anywhere from 1.5 hours to 2 hours. And when you go into your mommy makeovers, maybe 2 hours to 2.5 hours, depending if you're getting a breast lift or just implants. But again, they're sleeping the whole time.
Right.
So it's actually not fair because they're sleeping and cruising and we're working, but it's okay.
Are individuals different from one another? Are some people more prone to sleeping during the anesthesia? Or does it ever happen that someone wakes up right in the middle, or how is that?
Very unlikely. We tell our patients to be very honest and truthful because our anesthesia is based on the weight and also some other factors. Do they smoke? Do they drink alcohol?
Right.
Any recreational drug use? Because that requires more anesthesia. So if you're not forthcoming, we're going to give you the normal dose just based on your weight.
Right.
If we don't have those factors to factor in to give you more anesthesia. So we are non-judgmental. Just tell us the truth, and then that way we can come up with an anesthetic plan that will get you safely and comfortably off to sleep.
Well, thank you so much, Melissa. This is very informational, and I'm sure that all of our dolls are going to absolutely love to listen to you. Thank you very much.
It's my pleasure.
Next time you're here at CG and you say Melissa, come say hi. She's very nice and very knowledgeable.
Bye, guys.